Hello everyone, this is Dr. Tvisha Ramesh, gynecologist, going to talk about polycystic ovarian disease. So what is this polycystic ovarian syndrome? It is characterized when woman is having irregular cycles and excessive hair loss, acne and menstrual irregularities. So today we are going to address this condition which is affected by most women, around 40 to 80% of women suffering from this condition. So let's talk about it today. Polycystic ovarian syndrome affects women of all age groups, from adolescent, reproductive to the perimenopausal age group. So symptoms which include in PCOS are menstrual disturbances, starting from delayed menarche, that is not attaining menarche up to the age of 13 to 15 years. Second is having irregular cycles, that is once in 2-3 months or up to 6 months to 1 year not getting cycles at all, which we define as less than 9 cycles per year is irregular cycles. And next symptom would be excessive weight gain. In spite of your lifestyle modification, you feel that there is weight gain, so you have to address to this condition. So next common symptom is androgen excess. So what is androgen excess? Which includes acne and hirsutism. So what is hirsutism? Hirsutism is getting hair in the male pattern of growth, that is in your upper lips, chin, side cheeks or the thighs. Next criteria we take into account is polycystic appearances in ultrasound examination. But this is not a definitive diagnosis because the clinical symptoms with menstrual irregularity or androgen excess itself we can come to a diagnosis of polycystic ovarian syndrome. The other major symptoms are obesity, that is weight gain, that can also show as acanthosis nigricans. What is acanthosis nigricans? Is dark patches in behind the neck or in the armpits on the groin area. So these are one of the symptoms of PCOS. When we are talking about weight gain, so we should also keep into mind that weight gain can lead to PCOS, and because of PCOS there could be weight gain. So it is a vicious cycle and we have to break it at one point. If there is weight loss, there will be ovulation and the PCOS can be reverted, and because of that there could be weight loss. So there is a connection between weight loss and reversing of PCOS. So when should you visit a doctor? When you have one of the symptoms from menstrual irregularity or androgen excess, as I had explained earlier, or polycystic appearances in your ovaries, it is the time that you should meet a doctor now. So why should we diagnose polycystic ovarian syndrome? Because early diagnosis and intervention could help in the quality of life and well-being of women suffering from PCOS. Ignoring symptoms of polycystic ovarian syndrome can lead to anovulatory cycles. That can lead to subfertility. What is subfertility? Difficulty to getting conceived spontaneously. And not only that, it can lead to long-term health abnormalities like cardiovascular diseases, example like heart attack or ischemic heart disease, or endometrial malignancies like cancers, and type 2 diabetes mellitus, systemic hypertension on the long run. How do we reverse polycystic ovarian syndrome? First thing is to seek a medical professional opinion. Second, along with medical intervention, lifestyle modification is necessary. Along with the medications prescribed by a gynecologist, lifestyle modification is the gold standard for reversing polycystic ovarian syndrome. Lifestyle modification includes a balanced diet, good sleep of 7 to 8 hours. Third thing is physical activities like any form, yoga, Zumba, swimming, any physical activity is recommended for reversing PCOS. So physical activity for a lifestyle modification should be a guided journey monitored by a certified professional. Polycystic ovarian syndrome is nothing to be feared about. Early diagnosis and timely intervention will help to reverse PCOS.